Welcome, I'm Jacqueline Sullivan from the University of Adelaide, and I'm here to guide you through the basic guidelines of a U Slab for a fractured humerus. So, you need to gather all of your materials first. We gather a bowl of water that is at room temperature, our back slab which we've cut and patterned out to fit the length of the arm. So you use a tape measure. What you're measuring is from the top of the shoulder here, down to the elbow, and then back under the arm to the base of the armpit. So we've taken quite a long piece of stockinette, which is a size 3, and we've threaded it across the arm up towards the shoulder. As you're heading up towards the shoulder, obviously you can't go past the armpit and the body, so you need to cut a piece at the bottom here to allow that to spread out and come around the back of the shoulder. Down around here, we've also cut a slit in the arm, and we've tied it up at the back to make a sling for the arm to hang. The idea of a U Slab is the weight of the plaster pulls a traction on the fracture and keeps that in place. So next we will need our padding, which we have here. We have our padding and our bandages. So now we'll start to apply the padding. In this situation, the patient usually can't move their arm too much. So what we get the patient to do is to lean forward, and the arm will actually come out a little bit. So that will allow you to get under the arm. So we'll start to apply our padding here. The back slab will stop here. So we start about in this position here. So we start our padding further down the arm, as the back slab's nowhere near the upper part of the arm at all. We start to wind it around. Just watch out for not too many creases, and watch out for the bony prominence of the elbow. You may need to add a bit of more padding to that area if you can't get enough in there. Come round the back of the elbow and make your way up the arm. As you're coming up the arm, start to make your way up to the shoulder at the top here. You may need 2 rolls of the padding to do this, which we will. Just grab that other one, sorry. And start layering a bit at the top, because remember the back slab's going to sit on the top of this shoulder, so we just layer a bit like so on the top and then just smooth that in. You can secure that if it tends to pop out with a little bit more padding. So that's what the padding should look like. So now we're going to attempt to put our back slab on. So I'll just gather the back slab. Again, this material is quite long, so we'll take it and we'll fold it and we'll put it in the water. I'll just put this on that side just to make room. So we'll just take this out, flatten it out to smooth out any wrinkles and get that plaster embedded into the linear weave of the gypsona. Okay. So we've taken a slab. I've put a little cut into the side. That's just to help me fold around the elbow. So we'll take this and we place it on top of the shoulder, like so. And this is the hard part, is actually getting it to stay on the shoulder. We then get the patient's arm to move out as much as they can, and we bring that under. Fold in all your edges that you've got and crimp the front. Just smooth most of that on. Then take our bandage and start wrapping. Fairly good tension on this bandage to help hold the back slab in place. Take our second roll and start wrapping this up. Come up to the top of the shoulder like so. Start making the way down. And then we would tape that. Okay. We're just moulding this in to make sure it's actually fitting and hugging the limb. Now you've just finished watching the videos on back slab application, we're going to round off with some hints for you. Ensure you've got the right patient, the right back slab for that patient, the correct pain relief for the patient, an assistant to help you, gathered the correct equipment, completed a skin check, neurovascular, prior and post application, and a verbal consent from the patient. Thank you.